type 2 diabetes can be developed at any age. It can even develop during childhood. Most commonly, it develops in middle-aged people or who are older, if they have had a family history of diabetes, or if they are overweight or obese, they are more likely to develop type 2 diabetes. Then type 2 diabetes can develop in certain populations like African Americans, American Indians, Hispanic or Latinos. Those people who are more likely to develop type 2 diabetes who've had pre-diabetes in the past, or they've had gestational diabetes during their pregnancy. And then there are certain risk factors like physical inactivity or having other comorbidities like high blood pressure can lead to increased risk of type 2 diabetes. These are some of the symptoms that they need to look for. So if they are experiencing increased thirst, frequent urination, if they're feeling excessively hungry, if they're feeling tired all the time, if they notice some blurry vision, if they notice some tingling or numbness in their hands or feet, if they have any sores or ulcers in their feet that are not healing, or even unexplained weight loss can be one of the symptoms of diabetes. Type 2 diabetes can develop very slowly over a course of many years, and some people have extremely mild symptoms, and some people might not even notice the symptoms initially and can develop health-related problems related to diabetes, and that's how they get diagnosed. Like, for example, if they start having issues with their heart, any heart disease, or if they start noticing any changes with their vision, is when they initially find out that they have type 2 diabetes. As far as the health problem related to type 2 diabetes is concerned, the first and the foremost thing is that I tell my patients to follow a good diabetic care plan in order to prevent these health problems. And some of the health problems that could be related to diabetes could be heart disease, could be nerve damage, could be kidney damage, could be the foot problem, they could have the eye problems, and then any gum disease or dental problem, and even sexual or bladder dysfunction. Many people with type 2 diabetes can also develop non-alcoholic fatty liver disease, and losing weight if you are overweight or obese can help you tackle this problem. And other problems that could be related to it could be the sleep apnea, depression, many different types of cancers, and even dementia could be related with type 2 diabetes. So you can take steps to lower your chances of developing these health-related problems that could be related to type 2 diabetes. Research has shown that there are some steps that you can take to reduce your risk of type 2 diabetes. So the first and the foremost is that lose weight if you are overweight. You can lose about 5 to 7% of your total body weight. So for example, if you weigh about 200 pounds, you can lose about 10 to 14 pounds of your weight. This is not ideal, but this could be a big step to help keep you away from trouble with the type 2 diabetes. And then secondly, try to move more. So at least 30 minutes of physical activity 5 days a week would be helpful. Thirdly, try to eat healthy food. If you try to reduce your portions of the food just to try to help you in losing weight, try to eat less fat. This would be helpful. And then the other suggestions that I would have is that try to drink water rather than sweetened beverages, and that can certainly help as well. As of now, we do not have any cure for type 2 diabetes, but you can manage your type 2 diabetes by following a balanced diet, having an active lifestyle. Sometimes you would need medications. The American Diabetes Association is still working on there are researches that are going on to help prevent type 2 diabetes and think of a cure, especially for type 1 diabetic. So that is still in progress. For type 2 diabetes, obviously medications are very important, but the first and the foremost step for type 2 diabetes is always lifestyle modification. I think over here in West Virginia, that's something that we really need to look into. Following a very healthy diet is very important, and I think this would be likely an important step we can take to prevent the development of type 2 diabetes. And then I think having an active lifestyle can certainly help a lot, so that this would keep you off the medications and prevent the health-related problems that could happen with the type 2 diabetes. So I know it's a very hard news to hear when you get diagnosed with type 2 diabetes, but you need to look at it from a positive perspective. There are many ways that you can deal with this disease, and you need to remember that you have these countless support of others who have felt the same shock. So you have the support of our staff at Bridgeport Endocrinology, you have the support of me, and we are here to help you. And there are many things that you can do to manage your diabetes, like diet, exercise, medical support, emotional support. The key is that you need to dig in, you need to take action, know that we have everything to help you live a long and healthy life, and you are surrounded by people who know exactly what you're going through. We over here at United Hospital Center in Bridgeport are always here to help you. We will always be there for you.